welcome to our call today with our friend Alan Leafman. And I'm Sally with the Mesa Chamber of Commerce. I appreciate you guys being on the call. More than anything, we really want to record this for others who can't be here. And at this point, I'm just going to turn it over to Alan. He's kind of our benefits guy, and he's got a couple of great plans that we wanted to make sure our members know about, and non-members, because it's an opportunity that we feel is important for us to share. So Alan, at this point, I'll let you kind of talk about you and your company, and then give us the information that we all need to hear.
Okay,
and
thank you. Is my audio okay for everybody?
You're good.
Okay. I want to first thank you and Bob for inviting me to do this presentation today. I'm a 7-year member of the Chamber. I'm a almost 11-year resident of Arizona. And I've been a health insurance broker on the national scene for 1 year, 34 times. Seems like something new every year. This year is absolutely no exception. In fact, this might set a record for unprecedented change. First thing I want to do, I'm going to share some documents with you. Just want to talk about the state of the market. Does everybody see this?
Yep.
Yes.
Good. That's not what I wanted to show you. That's part of one of the documents. Sorry. That's the document I wanted you to see. Did it go away?
Yes.
All right, here it is. Okay, can everybody see that now?
Yes.
This in one simple page is kind of the state of the group health insurance market. The first figure that you see, $599 single, that's the average premium per month that employers who provide group health insurance plans in the United States paid in 2019. We don't have the figures yet for 2020. Obviously, they're up from that level. And the family average premium is $1,715 per month. For smaller businesses, which most of us as chamber members are, those numbers are even higher. This is a national average that includes some of the very largest employers who have considerable buying clout in the market. And that's kind of what we're up against in terms of the challenge of providing our employees and ourselves, if we own our businesses, with health insurance. And this is not something new. I mean, we've known for years that health insurance premiums have inflated at a far greater rate than wages have. And they continue to kind of vacuum up most of the discretionary dollars that are available particularly in small companies that have slowed down the growth of wages and bonuses and business expansion. And because of this, late in 2018, we sat down with the Mesa Chamber, and we began to look at ways that we might be able to attack this and improve on this type of a situation for the chamber members. Next page here, there's only one major takeaway that I hope everybody is able to retain from this meeting today, and it's this here: only by taking control of your health can you take control of your health insurance. There's a lot of band-aids that we can apply to reduce the cost of health insurance, but if we can really get a handle on our health, practice good preventive care, practice effective chronic condition management, then we'll be able to really put a stop to and eventually reduce the costs of health insurance. So We began developing the program in, I think it was September 2018. We actually launched the program for the Mesa Chamber in February of 2019. So we're now 16 months into our program. And I'm gonna show you our PowerPoint presentation on the program. We'll walk through that. I'm not gonna take too long. Our program is called the Lifestyles Health Plans, a World of Wellness. And we want everybody to know that this is actually the type of program that's written for most large businesses in the United States. Most large businesses, at least 7 out of 10, do what's called a partially self-insured program. And I'm not going to really get into all the nuts and bolts, but it emulates what large employers are doing. And the reason we can do that is that we've got 850 businesses in Mesa, so that's a lot of buying power. We have 2 objectives. We want to reduce employer costs, of course, but we want to do it while simultaneously improving the overall health of the business community. We're seeing premium savings that we say up to 15%. In actuality, we've saved some employers, including the Mesa Chamber, much more than that. We've got an experienced program manager called Medova Healthcare that started out on the clinical side in physician services and practice management. So they come from a clinical perspective. My company, of course, I've been at this for 34 years. How do we do reduced costs the way we've been doing it? We use a program called reference-based pricing, which I can go into in a minute, but basically instead of relying on hospitals and health systems to give us discounts, we're paying them a percentage of what Medicare pays, which is usually a much lower benefit percentage. You're not alone. Part of our program is called Care Advocates. If any of you have ever been given a diagnosis and had to enter the healthcare system, it's like going into a foreign country. We've got Care Advocates, which is a contractor that helps you navigate the system, vet specialists, arrange for treatments, and kind of walk you through that journey of healthcare when the need arises. Our program has a national network of providers. We've got over 800,000 physicians. We've got hospitals in all 50 states, about 6,000 of them. And in the Valley, we've got all the major health systems, including Mayo and including Cancer Treatment Centers of America, Banner, Abrazo, Honor, Dignity, and many of the community hospitals. We have 4 different types of plans, and each of those comes in 4 different configurations. So altogether, there's 16 different plans. And as you saw there, our copay plans, 12 of our plans are copay plans, include a $5 primary care physician copay. It's the lowest primary care copay in the business. If you've got 2 to 4 employees, we can do 1 plan. 5 to 9, we can do 2 different plans, and we can go up from there to as many as 4 different plans. Our plans have a lot of no-cost features that make them unique. Preventive care services, which are covered on all the Obamacare plans, are included in ours. We've got unlimited telemedicine for a 0 copay. We've got most lab tests at LabCorp. We've got diabetic supplies for no cost. It's all designed to encourage wellness and prevention and chronic condition management. We have incentives built into the program, so you can earn deductible credits immediately up to $500 by just doing an online health risk assessment. I'm sorry, this is going fast. If anybody wants me to pause, let me know. But here's a summary page, and I am going to pause this here. Let me go back into the presentation. And this is our.
Can you go back 2 slides? One.
Here?
No, go back 1 more, like the one where it showed all the, go again. Let's see. Okay, no, forward. The one that showed the benefits and the copay and the people.
There you are.
Okay,
Yeah.
right there. Pause there.
Yeah, it's paused.
Thank you.
So we do have 12 plans that include co-payments for services like primary care visits, specialist visits, which are a $50 copay, which by comparison these days is on the lower side. We have a $50 urgent care copay. And again, our no-cost benefits include something else that's unique to this program, especially for small businesses. We have over 400 brand name prescription medications through an international pharmacy program that are available for a zero copay. So if any of you have traditional health insurance plans right now, you probably have a multi-tiered copay prescription drug card. And some of those brand name medications can have copays as high as $75 to $100. We have 400 of the most frequently used brand name prescriptions for a zero copay. We've got a lot of generics at a $1 copay. The types of medications that you'd have to run to a pharmacy and fill immediately. Many of those are available for $1. The brand name medications, obviously, because they're coming from an international pharmacy, aren't something that you can obtain same day. But if you're on a brand name maintenance drug that you have to take every day for the foreseeable future, you can obtain those in most cases for a zero copay. Do you have any more questions on this page? No? Our lab tests at LabCorp facilities are a zero copay. Our diabetic testing strips, needles, and meters are a zero copay. And again, our care coordination services will schedule outpatient diagnostic services and surgical services and help you vet the best specialists and schedule the full spectrum of your care for you if you don't have the wherewithal to do that. And that can be a very daunting process. So let's go to the last slide here. This is just a nice summary. Again, we've got 16 different medical plans. 4 of those plans are compatible with health savings accounts. And for those of you who are familiar with those, we have deductibles starting there at $3,000. There's some very substantial tax advantages to those types of plans. They're very popular with business owners, and they come in 4 different configurations. We say premium savings of 5 to 15%. We know of cases, in fact, one person in our Zoom meeting right now, where their savings were actually in excess of 50% versus a comparable plan from United Healthcare. Some businesses that I talked to express concern about doing a plan switch in the middle of the year because they have the perception that they may have to start their deductible all over again. And that's not the case. If you start one of your plans with the chamber mid-year, you'll receive credit for any deductible that anybody has expended between January and whenever you begin your plan. We have 24/7, 365, zero copay telemedicine built into all of our plans. We've got the free lab tests, the option for the free brand name prescriptions. The option, again, once your plan goes into effect for all participants, to immediately reduce their deductible by $500. They earn half of that deductible credit by doing a voluntary online health risk assessment, and they can earn the other half of that by doing a voluntary baseline blood chemistry at LabCorp or in their physician's office if their physician sends this specimen to LabCorp. The advantages, tax advantages of the HSA I touched on. I can provide details to anybody who needs more information about those. We parallel all of the 64 different mandated preventive care and screening benefits. Hello.
Oh,
At no cost that are included on every one of the Affordable Care Act plans. We've got a very substantial wellness reward program built into ours. I've looked at wellness programs for 20 years now, and a lot of them use very complicated point systems and have pretty high barriers to entry. Our reward system is very straightforward. You're given a list of about 50 different wellness activities that you can participate in, and that includes just viewing a webinar on certain topics. And by participating in those activities, you're sent cash. You're actually sent checks from the health plan, not gift cards, not points, money. The program is, we say it's exclusive to Mesa Chamber members only. We have to revise that because last September, based on what happened in Mesa, the remaining 7 other chambers of commerce in the East Valley Chamber of Commerce Alliance now participating in this program. So we have a pool of more than 5,000 member businesses in the East Valley Chambers of Commerce. That's a lot of buying power. And we think because of that, our program over the years is only going to get stronger and stronger. And it will attract more and more providers who want to do special things for the participants in the program. Last on here is the fact that our program is available to groups insuring 2 or more. It's the only program in Arizona that will recognize a 2-person group if those 2 persons happen to be spouses or domestic partners that are the only people involved in a business. If my wife and I owned a business and we wanted to purchase a group plan from Blue Cross Blue Shield or United Healthcare, Aetna or Humana, we're not allowed to do that because of rules in the Affordable Care Act. But with our chamber program, we can do that. And we are very hopeful that at some point, we're going to be able to also include self-employed individuals. We made a real run at that last year. In fact, I even participated in getting a bill passed in the Arizona House and Senate that would allow self-employed individuals to purchase programs of this type, but a federal judge ruled against those. It's in appeal right now. We hope to win that appeal, but at the moment we have this plan available to groups of 2 or more. And this is just our contact information, which I can provide to anybody at the end of the meeting or after the meeting. But that's our program in a nutshell. And what we're finding is that for those chamber members who have participated in the program, by and large, those are companies that have the cost of employee benefits, group health insurance built into their business structures and who have maintained group health insurance benefits for several years or many years. For those members and for those newer businesses that are involved in professions or very highly compensated industries, our program has been kind of a blessing because between the savings and the program features, the lack of restrictions, by the way, this isn't an HMO where you have to choose a primary care physician. You don't have to get permission to see a specialist. Those are all things that the participating members really have benefited by. The thing that troubles me, however, is that over the last 16 months, of the new companies or of the companies that have never sponsored group health insurance benefits, we're finding that about 4 out of 5 of those companies, even with our competitive rates through the chamber, just can't afford to sponsor group health insurance plans. And if you recall back to the first document that I showed you, with an average single employee premium across the country of $599 a month, it's not that surprising that food service businesses, hospitality businesses, home healthcare companies, certain construction contractors, and other lower compensated businesses just can't find this within their reach at all. And so because of that, we wanted to start to, instead of abandoning those businesses and saying there's nothing here for you, we wanted to identify some other options for care, particularly for employers who are motivated to provide some type of benefits for their employees. And the newest program of that type that we're just introducing right now, and I think the timing couldn't be any better, is a telemedicine program called MD Live. And like I had described in the group offerings, we have free telemedicine benefits on an unlimited basis within the scope of the whole group health insurance program. MD Live is a standalone telemedicine program that anyone in the chambers can use 24/7, 365. And within 10 to 15 minutes of contacting MD Live, either by phone, video call, or a telephone app, they can speak to a board certified physician and receive diagnostic assistance and even have prescriptions sent into local pharmacies to treat any one of many, many different conditions. There's about 70% of all the medical conditions that can be treated in a doctor's office can be addressed and treated by MD Live. And I can't express strongly enough the price concession that we were able to get on MD Live for the chamber members. If you as an individual went on the MD Live website and you wanted to obtain one consultation just for yourself or a family member with one participating physician, the fee is $82. They don't offer individuals a subscription service at all. The program that we've negotiated for the chamber is $4.99 a month per employee, and that includes all of the employees' family members. There's not a higher family rate. It's one flat rate for an unlimited number of physician consultations, and those consultations are a zero copay. So if you and your spouse and your 10 children purchase this program, it would be about $60 a year. If you as an individual took one consultation, it's $82. We were very fortunate to be able to negotiate such a deep price concession, and I'm really proud that we were able to do that for our members. And I think it particularly because we're in the midst of this coronavirus pandemic is very timely, because the alternative, if you start to show some symptoms, is to go into a urgent care or to go into an emergency room where you're going to wait sometimes for many, many hours. You're going to be there with usually many sick and contagious people. And here's a way for you to avoid all of that from your home, from your telephone, wherever you are, and to do it for an extremely reasonable price. If you're an employer and you don't have any benefits, this is a great way for $5 a month to provide a meaningful benefit to your employees. If you have group health insurance now for a core group of, say, your full-time employees, and you want to give something to your part-timers, it's a great thing to do. If you have seasonal employees, if you have any independent contractors who work for you, they can all participate in this program. The only caveat is that we need, for the $4.99 price point, we need 5 persons per company to participate. If you have fewer than 5, even if it's just you, it's only $1 a month more. And it doesn't change any of the terms of the program. So this is truly something that we have starting for the self-employed members of the chamber, for the very small groups, And then for any group of 5 or more, it's that $4.99 price point. And as I say, I don't think it could have come at a better time. We have an enrollment site for employers. We have literature that we can send, but this is a little flyer. I can email something with a link to MD Live to anybody who's interested. And as I said, for those employers who just are finding group health insurance to be out of their reach, this is one arrow in your quiver, let's say, to provide a meaningful benefit to your employees and start to be able to provide them with meaningful healthcare solutions. Any questions about this at this point? No, okay. The title of our session today is, all I gotta do is find it. Healthcare in the New Normal. Is everybody seeing this?
Yes.
Okay. And I'm not going to take a lot of time to go through everything on here, but going back to what I said a little while ago about those employers who are simply unable to provide full group health insurance coverage. In addition to MD Live, there are many other options available today, some of which didn't exist, some of which are just coming into their own. And we want you to know that through the Chamber, you can access any or all of these solutions for your people. This little infographic talks about solutions that we have available for individuals and for employers. So even if you're a self-employed individual, we'll help you find a way to get the most meaningful health care that you can for your buck. And we start here with Medicaid, which in Arizona has become a very big program. And I'm only talking about Medicaid right now because with all of the layoffs that are occurring because of the coronavirus, there's many employees who are losing their health benefits, and they don't have to go uninsured. If their income is really going to crash next to zero, they can access Medicaid. If it's going to be a little bit higher, but if they're still going to take a hit, they will have an immediate opportunity to access healthcare.gov plans, and there's 44 of those in Maricopa County. And then based on your budget, we've got the program starting at $4 or $5.99 a month and up. And some of these are Band-Aid solutions. They're not full coverage. Some of them are more comprehensive. But another important message that we want you to take away from this is that there's something in healthcare now for every budget. And given the opportunity to assess your situation along with you and get an idea of what your healthcare needs are, we, through the Chamber and through myself, will try to identify those solutions that are going to be most meaningful for you. I spend a lot of time with my clients trying to convince them not to overinsure. I know that sounds a little bit odd, but many of the group plans that are either already in force or are being installed now have so much coverage that much of it will never be used. And what we find in healthcare, particularly employer-provided healthcare, is that everybody's heard of the 80-20 principle. In healthcare, it's more like 90-10, meaning 10% of the insured members of most employer groups are using, in some cases, 80% of the medical services, incurring 80% of the claims. In fact, I'm aware of one study that found among 7,000 employees, 1.5% of the employees were incurring 31% of the claims. So if we can have a discussion with you about what you and your family and your employees' healthcare needs are, we may spend a lot of time convincing you not to overinsure, but to correctly insure and buy the benefits that are going to be the most meaningful for you. We don't charge any fees. We're available to meet you at your businesses or at the chamber offices or my office. And, you know, we welcome the opportunity to do what we can to get you the best value in healthcare. And I can send this, this link to anybody who's interested in getting this little infographic.
Does anyone have any questions? Alan mentioned somebody on the call had a great rate. Well, that would be the chamber. Alan, correct me, but I think we saved 58% from.
It makes me
last year.
to tell other businesses that.
Well,
Their
and I'll say,
expectations.
I know that's not typical for everybody, but
Right.
you know, we had gone from United Healthcare, and we've had them for years, and the last 4 years, I think we went up 16, 17, 14, and 14%. Well, this year would have been 14%. I think those are what
year
our
ago,
numbers.
right.
And you know, we felt like we should look at this program. We did. We talked about it with our executive committee, obviously, and they looked at me like I was kind of crazy. It's like, well, why wouldn't you change? And I have to say, I've used all pieces of the program personally, and I have not had one issue with any of them. Sometimes, you know, you change insurance companies, and all of a sudden you go to give them your card, and oh, you're not in the system, or things like that, or you go to get a prescription, and you know, you're not in the system. I haven't heard anything from any of our staff that we haven't all had the same good experience. And when I say I've used everything, I've used medical, dental, vision, prescription, and the tele medicine piece. And well, and I got I did my online survey, and I got my, you know, $500 towards my deductible. I mean, everything has been really a positive experience for all of us. And it saved us a ton of money, which frankly, I have to say, when we were able to save that kind of money, we were able to pass on some of the savings, because part of the expense for our healthcare for our staff, or, you know, for the premiums, we had to share with the staff. So I was able to share some savings with the chamber and with the staff, which made everybody happy. And hopefully, because they were used to spending that kind of money, they were able to put some of that into their 401k. So great opportunity to at least have Alan give you a quote.
And can I add a postscript to your story?
Of course.
Because we just got to the 1 year anniversary mark, July 1st. And you know, I've seen many group health insurance companies, some of which I still represent, use a practice called buying your business, where they artificially reduce their rates in order to attract new clients.
Right.
And then you hit your first year renewal, and it's only going to go up 18%, and we're only going to raise your deductible $500. We just hit our 1 year anniversary with the Mesa Chamber. The benefits did not change. In fact, in some ways they improved.
Got better.
Because
Yeah.
we reduced some out of network exposure, and our increase was 1.96%. So this isn't a program that's artificially reducing its rates to attract your companies into their lair. It's really designed for long-term rate stability.
Yeah. I don't know. We just feel blessed that there is an opportunity like this for not just the chamber, obviously, but our members, and, you know, our smaller members, that saving $50 or $500, whatever it might be, is a big savings for a lot of our small businesses.
Yeah, these days, if you're struggling to make payroll, every penny counts.
Exactly. Allison, you have questions?
Yeah, so if we go on a program like this, then we can, because I know that some programs that you go on, if you have to go back and qualify for traditional Cigna, United Healthcare, all of that, then you don't. They say, oh, there's a lapse of coverage. This is going into a regular medical plan, so there's no threat of that, right?
I'm not sure I understand.
So in the past, and this might have changed because I haven't looked at insurance in a long time, but when if you go on other alternative plans,
Right.
like through ASBA and things like that, there's been
Right.
some things. Then when you go, if that fails or is not working or something's happening and you have to go back to a traditional, what we know of as
Oh.
Cigna, United Healthcare, all of that, they say, oh, well, you guys haven't had coverage. But this
No,
is just,
the Affordable Care Act did away with that, Allison.
okay. And the,
So
and the
even if
pre-existing
you were
condition,
uninsured, even if you were uninsured altogether, any plan through the Affordable Care Act, which would be Blue Cross Blue Shield, Cigna, Humana, United Healthcare, Aetna, will immediately cover pre-existing conditions. It can't charge you anymore because of medical conditions, and acceptance is guaranteed.
and what are the rates based on?
The rates for those plans are based on your age.
Right, but for your plan.
For our plans, they're based on the average age of the group.
Okay.
And this may sound counterintuitive, but because this is a large group plan, large group definition was set by the Affordable Care Act, meaning more than 50 people.
Mm-hmm.
The plans are medically underwritten, which means that the applicants fill out a short medical questionnaire, and after the underwriters review those is when we get our final rates. So if you ask me for a quote, we get your employees' ages, and we would give you a baseline quote. The actual rates based on the health of your group could be anywhere from 15% below the baseline quote to as much as 45% above.
Yeah.
And as I said, it's counterintuitive, but if you're now part of this plan, part of this pool, and you want long-term rate stability, it would be unfair to you if next week a 2-person group came in and the 2 participants in that group needed heart-lung transplants, because that's going to come back on your rates. So it is sometimes it's harsh and difficult on those groups with significant medical problems, but those are protections that are built into the program to design that long-term rate stability, like we're witnessing with the Mesa Chamber's own plan.
And did these plans cover any alternative medicines such as acupuncture through a medical center?
No.
Or anything like that? Okay.
It's a different program. We're always pushing to get alternative medicine added, but as of right now, no. Any other questions?
So to move forward, we would call you and explain, because we have 2 businesses. So I want to look at this for both of them. So we would call you and we would go through that. You and I just call your number.
Get a proposal put together for you, a baseline proposal. It'll show you all 16 plans. Each plan comes with 3 different network options. So it's really 48 different variations. And then if it makes sense to take the next step, then we can collect the medical questionnaires and get you actual firm rates.
Cool.
He makes it very easy. Anyone else? Mary, Naomi, Charlie, any questions? Very quiet group.
We appreciate that. I've actually had a chance to talk to Alan, and I'm currently covered by another plan, but when I leave my current employment, Alan will be the first one to call.
Awesome.
Thank you.
Now we have to have at least 2 people to participate though, right? We can't be self-employed?
I can't do it for self-employed. No. And we, like all group health plans, we have a requirement that 50% of your eligible full-time employees participate. In fact, most of the group carriers in Arizona want 75%, but our plan requires 50%. But when we do that 50% calculation, we don't count anybody who's got personal health insurance, VA benefits, spousal group insurance, if they're on a parent's plan. Basically, if they have any other type of coverage, including Medicare, it's as if they're not there. And then of the remainder, we need half. So we've never not been able to get a group through from a participation standpoint. It's very lenient.